Hi, welcome to HealthCast. Today I'm joined by Travis Hoppe. He is the CDC's first Chief AI Officer. Welcome, Travis.
Thank you. Glad to be here.
The CDC just released their new AI strategy. It'll be the strategy for the next 4 years. I want to talk a little bit about how the CDC has been really laying the groundwork for adopting AI and using AI for the past several years. What led to this strategy?
Well, thank you for asking. It is true that in the past couple of years, we've had a remarkable amount of growth in both the AI and the data side, but doing AI and machine learning broadly at the CDC is something that we've actually been doing for decades. So we have been doing modeling, we have been doing flu detection, we've been doing outbreak detection for many years. I think what's new is the rise of generative AI and very recently agentic AI. So as these technologies came out, CDC was one of the first agencies to release generative AI, was the first agency to release generative AI to all of its staff. And we've tried to be as much as possible on the forefront of all these new technologies, what they mean for us as an agency and what they mean for public health writ large. And we figured with the timing of generative AI and the rise of agentic AI, this was the right time for us to be releasing a strategy.
Mhm. So, what is the goal of your strategy? Is it disease detection, workflow improvements? Is it innovation? All of the above?
It is a yes and everything you said, with a few more things onto it. The first, we have four pillars, and the first pillar is the adoption of basically the abundance of AI that we have out here. The second would be the governance piece. It's really important as these tools come out. They have problems. They have biases. They have hallucinations. They have places where they work really well, and they have places that they don't. And so understanding that deeply, both in the context of the models, but in the context of what this means for public health, is a big piece of the governance and reinforcing public trust. I'd say the third pillar that we have is on our capabilities for our platforms. So CDC has EDAV, it has AMD, it has one CDP. These are all big platforms on which we run a lot of our computational and normal workspace on, and integrating AI deeply into these pieces, I think, are important, along with HHS releasing the big chatbots into our system, making sure that they're well integrated. And the last pillar would be on workforce. So that's the one you named a bunch of great things for us to do. But workforce is one that is absolutely critical. CDC runs an incredible community of practice with thousands of staff coming on every other week to talk about something really important or really interesting within the space. But also, we have office hours where staff get to teach each other about the new technologies. We have showcases. We bring in academics. We bring in public health departments from across the country to speak to us, and so that we can learn from them as well.
What makes the CDC's AI strategy unique, especially in comparison to Department of Health and Human Services and even the White House's overall AI strategy?
Our strategy is aligned deeply with the AI action plan that the president put out. It's aligned with the HHS strategy, but CDC has a unique mission for public health. And all of those things that are present within a strategy about governance and trust and adoption and acceleration, those are all present in the president's action plan. They're all present in HHS's plan. But what's unique for CDC is around our commitment to our state, local, jurisdictional partners. So we call them STILTs, but these are the counties, the cities, the states, the tribal jurisdictions that are so important for the rest of public health. So we wanted to focus within our strategy to make sure that we highlighted them, not just in terms of giving information down, but making sure that we can support them. I'll also note that this piece of supporting our local jurisdictional partners is part of CDC's mission, and it's tied deeply to our public health data strategy, of which AI is just a component of it. So it's part of the larger picture of how do we help public health across America, but this is the AI-related section.
So I'm glad you brought up partnerships. The White House just recently released their AI legislative framework, and it does look like it's meant to build trust, public trust in AI and AI practices. Is that something that you guys are also working on at the CDC, especially when it comes with your state and local partnerships?
So we view that, every government agency has their own stakeholders that they need to work with. NIH has their grantees, and CDC's is all of our public health departments. And so we worked really hard to release two documents to our partners. So in addition to the strategy that we've released two guidance documents. One is on implementing generative AI within a public health agency. So it's not just another explainer on what is generative AI, but it's also a way, if a public health agency is at a different level of maturity than their federal partners, which is us, they can look to it and say, hey, what worked for us? What were the failures? What were the challenges? What could they use to help them
Mhm.
adopt and do so safely? The other document is on the agentic AI piece. So there's a lot of different pieces when people say agentic AI, it's not really well defined, but there's a couple technologies that are coming out. One of them is on deep research, where you can ask an agent to go out and build a huge report of whatever topic you want. And you'll get a 10 to 20 page report. All the frontier large language models have this capability. But what does it mean for us? When is it useful? When does it fall short? And so this document is coming from a large internal study CDC did, and we took it, we found the best parts of that, and we distilled it down for our state and local partners. And so again, this is this partnership piece. We work closely with our partners to find the best pieces. What do they need? What could we provide? And then we went back within CDC and found out what are our lessons learned and how can we distill them out to our stakeholders.
So you talked a little bit about agentic AI, and I was wondering if you could expand more about its role with the AI strategy, and then also what kind of oversight tools you have in place, especially when it comes to agentic AI.
Yeah, great question. There's a lot with agentic AI. And again, it's kind of undefined because it can mean so many things to so
Mhm.
many people. I mentioned deep research, which is kind of broadly under the class of tools that will help you do knowledge production, right? Whether it is building reports or it is looking within your own knowledge bases. I think those sort of tools are getting much better, and being able to
Mhm.
hook in subject matter expertise into them is turbocharging a lot of the things that we do. The other big piece of agentic AI is improving programming. And so this is like people who are programming in Python or in R or any other programming that we have to do as our day-to-day programmatic activities. We're finding agentic AI to be incredibly powerful on this one. I'll note that you asked about security, you asked about trust, you asked about governance. This is a new place for all of us,
Mhm.
both here within the federal government, but also within industry. I work really closely with our OCIO. We work really closely with the HHS OCIO. We're thinking through what does the zero trust model look like for agentic AI? When should models have access to data? When should they have permissions beyond, just making a request? This is something I think that everybody's working through. I am really excited that we're thinking about this now, and we're looking at use cases right now for us to, start implementing.
Okay. So I have a twofold question. The
Okay.
first one is, what does success look like, and what keeps you up at night?
Great. I mean, for success looks like what we outlined in those four pillars, right? I think we've done a pretty good job over the last couple of years since 2023, since we released chatbots to the agency on the adoption piece. We've got all sorts of really fun metrics. We did a great return on investment study, and we're like, this is great. We saved millions of dollars. And so continuing to watch the adoption go forward, this is great. This is tempered with, are we using the technology correctly? Are we making sure that it's integrated into programs and they're not just one-off, pilot projects? Are they part of our core programmatic activities? And does our workforce feel empowered and enabled to use these technologies and not feel like they're being replaced? And so to me, if all four of those things were checked off in a year or 2 years, I would feel like it was a really successful strategy implementation. So going back to your question on what keeps me up at night, um, a lot of the use of the agentic I think, particularly on our stakeholders. So CDC's mission is broadly around public health, but it's also about dissemination of this information. And I think it's incumbent upon federal agencies, but also the state and local public health departments to make sure that we're meeting our customers, we're meeting our stakeholders where they're at. So if people are looking to generative AI or agentic AI to get their information and we're not meeting the mark there, I think that's incredibly important. So keeps me up at night is thinking about where people are coming to us and making sure that we can meet them where they need to
Mhm.
be.
The plan does rely on public private partnership. Can you talk more about the role that the private sector will play?
Yeah, again, another great question. The space is moving so quickly. We have the frontier large language model companies that are doing incredible things with innovation. And we have just tons and tons of medium-sized innovative companies. Some of them are, just doing generic pieces on AI. Maybe it's like text to speech or language translation that are broadly applicable. And there's other companies that are doing things specific around health or public health. And so I think it's incredibly important for all federal agencies to be as deeply involved and at least communicating with these companies to see what the state of the art is. I think there's a lot of issues around making sure that the technology that we use is FedRAMP approved, it has gone through
Mhm.
this proper cybersecurity procedures. But that is a solvable problem. That is something that we're working with. And so kind of excited to have all these companies to work with. Just like a gentle reminder that there are laws, there are policies that we have to do before we could bring them into our government systems.
So before we wrap, can you tell me what is one message you hope that viewers take away from this?
So if you're listening to this podcast or this recording, you are deeply interested in how AI is transforming how we consume information, how we process information. I think it's really important to note that this is changing every 3 months, and our abilities need to be continuously reassessed. Whatever we think we know, what capabilities are possible right now, they will be different in 3 months, and they will be vastly different in 6 months. And so, as much as possible, as the thought leaders listening to this, I hope you can take it back is like, let's understand and assess the technology now, but keep an open mind to what's happening in the future.
Well, because things are changing so much, is this a document that will have to continuously be updated? The strategy will it also change with time?
I think the strategy is written broadly enough that it doesn't call out any specific technology. So our guidance documents that we gave out to our state and local partners, those may need to be updated, right? Because they call out
Mhm.
very specific technologies. They call out maturity models for generative AI. And those will be great point in time documents. I'm super happy that they exist now, and I hope they'll have a lot of value in the next couple of years. I think they'll be outdated fairly soon, and that's fine. That's great. The technology is moving forward. I do think the strategy is written because it covers things like adoption. It covers things like public trust and capabilities of our core platforms. It covers workforce. That's not going to be changing over the next 5 years.
Travis, thank you for joining me. I can't wait to see what is on the horizon for the CDC and AI. Is there anything you want to add before we leave?
No, I think that's it. I appreciate it.
Thank you.